Namaste and good afternoon, respected faculties. Today I am going to present my thesis topic presentation on the functional outcome of short segment posterior fixation in the dorsal-lumbar burst fracture. I am Dr. Krishna Jung Shah and my guide is Associate Professor Dr. Bhojraj Adhikari and co-guide as a Assistant Professor Dr. Badri Rijal. I'd like to start with my I'd like to start my topic with introduction. Spine fracture are common in today's world and country like Nepal due to the high frequency of the road traffic accident, fall from the height, and the other are the major causes of disability in the adult. Thoracolumbar burst fracture are inherently unstable due to the transitional zone and require surgical fixation to avoid the complication of the prolonged immobilization and occurrence of the progressive kyphotic deformity, and fixation can be done with the short segment or the long segment. However, in my study, I have studied the functional outcome of the short segment posterior instrumentation in dorsal-lumbar fracture. According to the literature, out of all the spine fracture, the thoracic and the lumbar fracture account for the 90% of the all spine fracture, and the 7% mortality is due to the traumatic spinal cord injury. According to Dennis et al., burst fracture is involves the compression failure of the anterior and the middle column of the spine, and EOA has classified into the A, B, and C category. Incidence is 5 million per year globally, and the neurological deficit is in 20 to 40% of the population, and the American Spinal Injury Association score has the tremendous prognostic value. A study done by N. Tanapannan et al. Showed that 70% excellent result in the short segment fixation. Our objective is to assess the functional outcome of the short segment posterior fixation in the dorsal lumbar burst fracture. Our specific objectives are to assess the pre and the post-operative neurological status, vertebral height, kyphotic angle, post-spinal canal width, pre and the post visual analog scale, OS-Wesley disability index. The method of the study was prospective study who are admitted with the dorsal lumbar spine fracture of not more than 3 weeks of the duration, and the pathological fracture and the injury greater than 3 weeks were excluded, and the ethical clearance were taken from the National Academy of Medical Sciences. The method was pre and the post operative neurological status, visual analog score, ODI score, vertebral height, kyphotic angle, canal width, and rate of person were calculated at the immediate post operative period, 1 month of duration, at the 3 month of duration, and at the 6 month of duration. The total sample size was 20, which ranges from the 18 years to 70 years. The 65% there was the male was 65%, whereas the female was 35%. The neurological outcome was significant in the functional outcome in those with incomplete neurology. Statistically significant difference were seen in the VAS score and the ODI score. None of these cases developed kyphosis or loss of correction in the follow-up. Clinical outcomes were similar to that of the long segment fixation that allows for the spinal stabilization while the simultaneously preserving as many motion segments as possible, as described by the various authors. The limitation of my study was there was a small sample size, less follow-up time. So we concluded that short segment spinal fixation in the thoracolumbar burst fracture with or without intermediate pedicle screw provides a functional outcome similar to the long segment fixation. These are my references. This concludes my presentation. Thank you.